So in this environment, there's just so much we've talked about new normal and things like that. And so there are a lot of issues that come up that probably weren't anticipated in some kind of divorce agreement previously, even just as recently as a couple months ago.
Mhm.
So what happens then on some of these things that were not sort of spelled out? So if one parent gets sick and has COVID-19 and ends up in quarantine, but the other isn't, and the child isn't, or those kinds of things, what happens there? And how does that all kind of get navigated through, especially that during the time when there's no courts in session?
Sure. So, under the family code, we need to look at what's in the children's best interest and ensuring the health and safety of the children, but also ensuring the parents get frequent and continuing contact. So, a reasonable interpretation could be suspend all visits with the parent that is been diagnosed with COVID-19. However, we're not saying take away all time from the parents. It just will be rescheduled once that parent has recovered from it. Now, the question is, what if a child's in the parent's custody when that parent's diagnosed with COVID-19? Well, reasonable interpretation again would say that child should maybe probably be quarantined with that parent for the 2 weeks or whatever the doctor is recommending. If the child's with the non-COVID-19 parent, then of course that child should stay with that parent until the other parent does recover. And we're looking at doing makeup time. And if the parent with COVID-19, if they can still do Skype, phone calls, Zoom calls, whatever we can to have the continuing and frequent contact between the parents and the child.